This is a fantastic question, and the answer to this question is why cool sculpting works. So fat and skin are very different tissues. If you have reduced blood supply to an area of skin and fat, the fat is not as hardy as the skin. And so if the blood supply is not great, usually the fat is the first thing that goes. Now with cool sculpting, we use that fact that the fat is not as hardy as the skin, cool an area down, cold enough to get rid of some of the fat, but the skin is fine. So often when you have an area of ischemia, I think you were asking about tummy tucks, so an area that's not getting good blood flow and maybe the skin made it but you lost some fat, you'll have hard lumpy areas under the skin. So how do you know if it's fat necrosis or if it's scar? Now as for your other question, it can be challenging to tell the difference between a little nodule of scar tissue or a little nodule of fat necrosis. But I will say in general, where they're located with the particular surgery usually leads you to your diagnosis. So nodules of scar tissue are rarely anywhere other than where there's suture lines. So you usually have them around where the incisions are. So if you're feeling a nodule where there's some kind of incision or suturing or sewing, it's probably scar tissue. And if you have nodules elsewhere, it's usually not. And it's important to look at the whole situation. So if we know this area had trouble healing and we were worried about ischemia, the area has shrunk a little bit, the fatty tissue layer is less in that area, and you have a little nodule, all of those things point to fat necrosis. So yes, fat necrosis can be challenging to diagnose because it can masquerade as other things.